My name is Scott Fishman. I'm the executive director of the Office of Wellness Education in the School of Medicine. I'm also a pain specialist and a professor here in the School of Medicine. And many of you I see some familiar faces have maybe come to our luncheon rooms before. It's an initiative of the School of Medicine to try to address the other part of the elephant, health. This idea that it's part of our work to look at keeping our patients healthy. I know you all know that. We haven't beat that out of you quite yet. So we're trying to lure you with a really nice lunch. Hopefully it's a good lunch, you're enjoying it. And then to talk with you about different issues around scope of practice. And we've tried to give you different examples of how wellness is part of the practice of medicine in so many ways. And as you take a bite of your food, you may think about how food may relate to medicine. You've probably all heard of food as medicine. You'd probably be better off treating a diabetic if possible with changing their food in terms of sustainable lower risk options than the medicines that we use. But the other part is food is food, and if we help our patients to find eating food that's not medicine, but food that's good nutrition that they enjoy, they find delicious, they may not ever have the disease that requires medicine. So, as simply as possible, we're looking at those areas both in terms of lifestyle and environment, etc. So, without further ado, that's why we're here, and I want to introduce our two speakers today. Chef Sky Hanka is a CIA-trained chef who works in the Office of Wellness Education. She also has graduate training in nutrition. And John Lew is a medical student who you all may know. He's a second year, but also is trained as a nutritionist and RD, correct, John? Mm-hmm. So John is officially our advisor, the medical student advisor to the Office of Wellness Education, and has been a tremendous asset, to what we're trying to build. So without further ado, I will turn it over to our wonderful speakers today. Thank you for coming.
Nice. Thank you. Perfect. Well, welcome everyone. We already got our introductions out of the way, so we can get into the good stuff.
So starting off, really the question we wanted to talk about today is why should physicians be knowledgeable about nutrition? How many of you guys think that we have enough nutrition in our medical school curriculum today? Show of hands. No. Yeah. Do you guys feel like nutrition in our medical curriculum would make you guys a more complete, better physician? Yeah, I kind of felt that too. And I mean, again, my background as a dietitian, I kind of started off in the nutrition realm before coming into the medical school realm. And so today I kind of wanted to talk about why this is kind of something important that I believe in, but also something that I think can benefit a lot of people in medical school about nutrition in medical education.
Yeah, so I feel like too, kind of branching off on that, we kind of see this like old paradigm of disease treatment where someone's sick, they come to the hospital, and then, they get cured and leave. And part of that conversation is what we're going to talk about today too, and kind of this new paradigm of healthcare and wellness, where I'm going to kind of fill in with my background as not only a master's in nutrition, but I'm also a board certified health and wellness coach. So a lot of my training focuses on behavior change, how to have those conversations, how to identify when someone's being resistant or what barriers they're going through, and how to kind of walk them through the steps and promote more wellness in their own lives.
So a couple of things that we think why it's important to talk about nutrition in medical school is, one is poor diet, lifestyle are really the leading cause of a lot of diseases in the United States. There's a shift, like Sky was talking about, we'll talk about from healthcare, from a disease management to more of a health promotion aspect as well. As you guys may have known, there's a lot of nutrition misinformation out there, and a lot of times patients, and even ourselves included, don't understand or don't know what's valid and what's not valid as well in terms of all the nutrition misinformation. Another is the increased interest that a lot of people are having as well on wellness and self-care. You can see that a lot in the new kind of technologies and the new trends that are appearing. More people are interested in kind of taking care of their bodies in different ways, and nutrition is definitely one of those parts as well.
I missed the last one. All right.
That's okay. And finally, again, this is kind of another plug to why we're talking about our culinary and lifestyle medicine here at UC Davis Wellness. So one of the main things is talking about, again, was how poor diet and lifestyle are really the leading causes of death in the United States. So this is just a graphic pulled from the CDC, and looking at the top leading causes of death, and in the United States, we can see that heart disease, cancer, stroke, diabetes, chronic liver disease, and cirrhosis. Some of these big ones right here, these are actually all nutrition related and things that can be prevented with proper nutrition as well. And thinking about how if these are kind of the leading causes of death, especially like heart disease being the #1 leading cause of death, instead of letting someone get to that point where they start having the disease, how can we prevent this disease from occurring initially, and then we can prevent that death entirely.
So kind of talking about the shift from disease management to health promotion. I don't know if y'all have ever seen this model. This is John Travis. He's a physician who kind of patented this little health wellness continuum in 1972. He actually opened one of the first wellness centers here in California. I really like this model and how it shows kind of the treatment paradigm, which is kind of your scope of practice currently, which is disease treatment. And then we hit this neutral point and go into more of a wellness paradigm where we are focusing on awareness, education, and growth. And I bring this model up because a lot of you are going to live in the treatment paradigm, but once we get into the wellness paradigm, there's so many people who can help support you in that area that you can partner with to promote wellness, whether it's an RD or a health coach or a CNS, or we're doing, culinary medicine workshops, anything like that. But today, once we kind of go farther on, there are some specific tools that we can talk about in the awareness, education, and growth area that you can utilize within the treatment paradigm to help initiate these conversations with your patients and kind of get the ball rolling more in the kind of lifestyle area.
So just talking about nutrition misinformation in general, we know a lot of times there's a lot of misinformation out there spread through a lot of social media. Like back then it used to be tabloids and people on different kinds of diets. You'd get advertisements for it at all. And just trying to make sense of what is true, what is not true, kind of what will work, what won't work. And a lot of times this is the message that a lot of our patients also receive, right? When they see something like this, they think, okay, well, maybe I should try this. Is it safe? And a lot of times, we should be also educated in this information or in this realm so that we can talk to them when they bring up these concerns. And that's kind of one of the big parts. Colorado State University actually had to come out with a nutrition misinformation guide to try to talk about how to identify frauds and how to identify misleading kind of nutrition information for their practitioners, because again, there's not a lot of education that we've gone through as well, talking about like how to discern kind of the misinformation, the truths from the lies as well that are being spread. And these were just some examples I saw, but I know that you guys probably all seen a lot more different examples of misinformation as well.
Yeah, I love that you included the TikTok of the fruit is bad. I think we've probably all seen the Instagram and the reels where it's don't eat this, don't eat that, everything's toxic, it's all killing us kind of thing. Mm-hmm. Perfect. So going into kind of the other why of increasing interest in wellness, I think we're all kind of realizing that obviously there's many things that can impact our health and wellness. We also have technology being introduced into this now with iPhones and the Apple Watches and people tracking their steps. We have apps now telling people what to eat, how to work out, how to be more mindful. So there's all of these different integrations because I think everyone, it would be interesting to run into someone who says they don't want to be well. We're probably never going to find that. The longevity movement and kind of the vitality movement's also another conversation that's happening. If any of you are familiar with Zoe, they're one of the like nutrition experts that have been publishing a lot of science on nutrition lately, and they focus on a lot of longevity. Same thing with Huberman. You've probably listened to his podcast. He brings on a lot of different scientists to talk about longevity and wellness. Muscle-centric health is also a starting conversation. Dr. Lyon, she published a book on protein and muscle-centric health and how maintaining your muscle is good for overall wellness. So there's all of this information out there, and people are really looking to understand how to apply it in their own lives, so they can, live a well life and age healthy. One of the other kind of whys too is this kind of emerging realm of culinary medicine and the food as medicine movement. I would love to know, kind of show of hands, how many of you have heard about this movement or are aware of it? All right, nice, so a good amount. So part of my role in the Office of Wellness Education as the Associate Director of Culinary Health is to kind of integrate some of this knowledge with John into the healthcare system and talk about it in detail, because it is really interesting of how we're able to see at the bottom this like population health policy and programs, which is more just like nutrition education and information. That's more like, the awareness growth area of the wellness paradigm. And then when we get into the produce prescriptions, the medically tailored meals and groceries, that gets into your treatment paradigm. So those are actual tools that you can use in your practice to be able to prescribe someone a medically tailored meal if they're diabetic, or to look at food access with your patients too, because that's also a concern. But this is a really fun area to start to explore, because this is going to give you some of like the how-tos incorporating the culinary education and the nutrition education into your scope of practice. You want to add anything that I'm missing?
No, this sounds good.
And this is just another kind of illustration of like a food as medicine approach in healthcare, where we're looking at social needs assessment and physician evaluation, and then some of the tools that you can use within your practice, such as the medically tailored meals, the groceries, produce prescriptions, and of course the nutrition and culinary education. Nice.
So now talking about why physicians specifically should learn about nutrition. If you still have registered dietitians like myself. So no, I don't think it's kind of an impediment on like a dietitian's kind of role if a doctor kind of starts understanding more about nutrition. Mm-hmm. And actually there's a lot of benefits to that as well. So for one, you want to help out your patients as best as possible. And doctors are a really trusted source that a lot of patients come to, right? They'll come to you asking about different diets. They'll come to you asking about different supplements. They'll come to you asking about certain things that they've heard about, again, with the misinformation as well. And, they trust you, or they hopefully do trust your doctor, yourself as a doctor. So they want to be told from a source, a reputable source, kind of what is true, what is false. And so that's part of it. That's, one of the big ones. We want to be able to talk to them fluently as well. We should be able to know a little bit more about nutrition than what is just like the biochemistry behind it as well that we're learning. Secondly, it's again prevention of chronic diseases. There's so many chronic diseases that are affected with nutrition, and again through the prevention of these chronic diseases, they can really benefit the patients in the long term as well. And again, understanding the medication part is very important as well. Understanding lifestyle and nutrition as well can definitely be beneficial towards supporting the patient as a whole. Translating some hyper-focused nutrients into physical practice as well. So, as you know, we learn a lot in terms of the biochemistry, in terms of the metabolism pathways, but a lot of that kind of is really focused on kind of certain vitamins, certain nutrients, and kind of helping out a patient. How does that translate to talking with your patients about it, though? One of the things is, again, more emphasis on a nutrition-focused education would allow that kind of understanding and that high level that we understand it to be able to be translatable to our patients. And that's kind of really what we're trying to do, is help our patients out as best as possible. And this can definitely help translate to applicable things. Again, like Sky was saying, looking at the social needs of the patient as well. All these things can contribute toward a patient, not just because they have a deficiency in, say, B12 for an instance, but why is there a deficiency and how can we support them with that? It also allows for a better conversation and multidisciplinary collaboration. So again, when you work with a healthcare team, everyone's gonna have a specialty. Everyone's gonna know something that the others don't. But again, being a little bit more knowledgeable in all the realms can help that crosstalk, help that collaboration. It's kind of thinking of the same reason, like we do have pharmacists still in the hospital, but that doesn't mean that we shouldn't understand a lot of the medications that the patient's on as well, right? Another one can be just for your own health and wellness as well. Again, like Sky was saying, a lot of people can benefit from this nutrition and wellness education, doctors included. And there was a study back then where they found that there's a strong correlation between smoking and lung cancer. And before that, you would see a lot of doctors smoking as well, until that came out and showed that there was a high correlation of that. So same thing. It's like this can benefit your health as a physician as well. And then finally, the systems thinking approach.
Yeah, so the systems thinking approach is kind of understanding that, like, yes, we have different physicians who are kind of focused in different areas, but our body is one body. And all of these, systems that we have, whether it's our lungs or our gut or our brain, all have kind of this feedback loop built in. If you've researched into the gut-brain connection and how our gut microbiome influences our brain health, how it also influences our hormone, I think this approach kind of helps encapsulate that everything's kind of working together, and that we can enter into any part of that system to help promote wellness. Nice.
Okay.
The fun part.
Yeah, so now's the fun part. So again, we talked about the why, like all the benefits of learning about nutrition. And of course, this 45-minute talk isn't going to give you all the knowledge you need to start counseling patients on nutrition, give you all the nutrition background. But we do have some applicable things that we can start applying. Sky will start talking about how we can start to incorporate and start that nutrition talk.
Yeah, so kind of starting the conversation and moving into this side of our wellness paradigm of like how we can cultivate wellness and look at basically awareness, education, and growth. So many different tools in terms of health promotion and behavior change. This is really fun stuff and I love talking about it just because at the end of the day you can tell someone to do something, but are they actually going to do it? So there are ways we can have more nuanced conversations to understand where people are at, how we can meet them where they're at, and kind of coach to the gap, if you've ever heard that terminology. So I hope probably you've seen the stages of behavior change, and then on the left side is Maslow's hierarchy of needs. And the reason I chose these is because people can be in any one of these stages of behavior change within this hierarchy, which is just important to understand, because if you have a patient who's maybe like a newly diagnosed diabetic and you're trying to change all of these things at once, but maybe they don't understand what diabetes is or what's happening in their body, then they're probably at this pre-contemplation stage of where they're at, and there's a specific way to kind of coach them through that conversation so that they can be able to be more open to those kinds of changes. And I don't know if you have any other examples you kind of want to talk about.
Yeah, I guess you'll see at your in clinic and different things, but you'll see a lot of patients that are diagnosed with kind of like let's go off the type 2 diabetes. And again, one of the first things we're taught is there's medical management of it, but at the same time, a lot of the patients that we talk to say, you know what, I don't want to start a medical treatment for it at this time. And then what's your next step then, right? And so this is kind of the part is maybe we should have other tools in our tool chest to kind of work with the patient that doesn't want to start on a medical management for their type 2 diabetes, or we can kind of understand, in terms of lifestyle management, in terms of nutrition, what else can we provide to the patient? Because again, at the end of the day, we want to support them where they're at, and we can't just tell someone to take metformin if they say, I don't want to take metformin, I want to work this somewhere else, right?
And some of those tools will kind of depend on like what stage your patient is in. So looking at like awareness, education, and growth as those three little sections in our wellness continuum. In the awareness stage, maybe someone's like newly diagnosed, maybe they don't really understand what's going on. You can use different kind of techniques or tools like active listening, which is one where it's just like listening to the patient. It's exactly what it is. If you have time to, at least, and actually having a conversation with them, because a lot of the times when someone says, I can't, the next question for you is, well, what is stopping you, or what are the barriers, or well, what would the benefit be of making this change today over the next couple of weeks? And you can kind of target them in a different way to open them up a little bit. Another thing is positive psychology, which just kind of is the concept not of just being positive, but just understanding how to cultivate more of a growth mindset within the patients. Creating a healing presence is kind of like what you were talking about, is in terms of, you know, if you're meeting this wall, what other tools can we use, and just kind of listening to the patient. And then another big one is intrinsic or extrinsic motivation. If that's something, you can ask questions of like, you know, well, if we made this change today, what do you think the outcome's going to be in 2 weeks? Or, well, if we don't do this now, how do you think you're going to feel in 3 days? And helping identify more of the motivations of that behavior change versus just, well, if you don't do this, then this is what's going to happen. Instead of telling them, it's just inviting them into the conversation and asking them. And a lot of kind of like health coaching training focuses on being like a health ally and not necessarily an expert. And y'all are the experts, and that's such a tough line to walk sometimes, because you want to just tell people what to do. But if you kind of switch hats for a moment and invite them in with a question, sometimes that just helps kind of break those barriers and initiate the conversation in a way that's a little more inclusive. If someone's, you know, in this education stage, this is where you can like look at referrals to RDs. You can coach the gap, like I say. There's a thing called motivational interviewing. Have y'all ever heard that term before? Yeah, so you probably have kind of heard some of this rhetoric then of like using ORs, which are open-ended questions, affirmation, reflective listening, and summarization when you're talking with people. And then of course looking at support groups. And then in this growth stage, we can look at things like using SMART goals with a client, where you're focusing on a very specific goal that's measurable and time bound, it's attainable, it's realistic, all that good stuff. We can look at team-based care models, and then continuing kind of monitoring and reassess regression. I think the main thing with all of these is just really understanding where your patient's at. You know, how do you identify if they're in pre-contemplation? Well, obviously they're unaware, maybe they don't want to make a change, all that good stuff. How do you identify if they're in the education stage and the growth stage? You kind of have to use your best judgment and just listen to kind of the words that they use and the rhetoric that they use. This was a cool one that I found online when I was kind of researching in terms of what kind of like nutrition education is out there, or behavior change education is out there for physicians, because in the kind of health coaching world, we use a lot of SMART goals. This is kind of the equivalent for a physician, where you're using the 5 A's, where they kind of give you examples of asking the questions, do you exercise, what do you typically eat for breakfast, then advising them with, oh, okay, well, we know you need to meet X goal or do X, Y, and Z in order for our next steps, and then kind of moving them through the stages of change by assessing, assisting, and arranging. Yeah, did you want to talk about anything on this one?
No, this is good.
Cool. So we figure we kind of open it up now for just like Q&A and questions, and kind of understand what would you like to talk about in terms of the realm of nutrition, and what specific questions you have. Yeah.
I have a question about reality. I have a question regarding like the reality versus like theoretical referring. So I know that like most Americans, we have health insurance, right? And I wanted to know if you knew if health insurance is more likely to improve now than they used to be referrals to dietitians and nutritionists, because like as we talked about earlier, we have a gap in our knowledge when it comes to stuff like that. And with some of these diseases or even preventable causes, it would be nice to be able to do that, but I know based on like anecdotal experience, it's not likely to be approved by insurance. So like, how do we go about that? Because many Americans don't have the excess funds to pay for additional dietitian or nutritionist.
Mm-hmm. Do you want to take it, or do you want me to take it?
You can take it, yeah.
Yeah, so there is, through the food as medicine movement, there's more coding emerging for that, where you can do like a RD referral education, you could do like a group referral support. So there, if you go to, I'll share a resource after this because I have a whole resource list, but there is a resource list from one of the food as medicine movement people that has some of the coding, so insurance will cover it. And they're also working on right now within that movement getting like cooking demonstration and nutrition education covered by insurance. Am I forgetting any other ones? But there's it's in the works, and I think there is already coding in place for some of the like basic referrals or just like basic education.
Yeah, so for a lot of the like type 2 diabetes, if you're diagnosed with that, there is coding you can use that you can refer out to a dietitian, and that should be covered. But again, for a lot of times in terms of preventative, there's not as much yet. And so that's what Sky's talking about, trying to do a more preventative thing as well, because again, everyone can use this education, right?
Can I just add that, we're going to have Dr. Rashma Gupta come, who's really trying to put this into practice in primary care, and she'll speak really directly to this at another luncheon room.
Nice.
But she's a resource, she's a professor here, if you wanted to reach out to her. You can connect to her.
Yeah, nice. Other questions? Any questions about random things?
I have a question.
The only way the mic picks it up.
Yeah. Are there any resources you guys would recommend in terms of things related to cost, for example? That's oftentimes a big barrier, especially with inflation in the past several years. The cost of these foods that we recommend just going up. It's more difficult for patients to obtain those things that they know is healthy, but maybe they can't afford it.
Do you want to take?
Yeah, so a lot of times, again, depending on your population demographics, they'll be qualified for certain governmental subsidy programs, SNAP, WIC, and such forth. Another part of it is education about it. So again, when you work with a dietitian, they'll kind of understand a little bit more and kind of help them tailor a more specific, either it be financial, either cultural kind of diet, meal plan, whatever they need. And that can kind of work with them as well, because you're right, like costs of everything have been going up, and it's actually, again, very challenging to meet a lot of those current goals with it.
Yeah, I would say eatrightpro.org or .com is a great resource. They're the part of the Academy of Nutrition and Dietetics that come out with the dietary guidelines for US. And the 2020 to 2025 ones are actually pretty great because they're shifting less on like the food pyramid or my plate and moving more towards dietary patterns and inclusivity. So they, in that guidelines, have a lot of references for like how to reduce your food costs. Like, if you can't get fresh vegetables, frozen vegetables can be just as nutritious and affordable. They also address things like meal prepping, where you're making one meal and then kind of moving it. So digging farther down that rabbit hole, there are resources, and that is at least where I think we're kind of the culinary medicine realm has to come into play too, because it's like, okay, well, we can tell you what to eat, but how to actually do it is also very difficult. So once we kind of have more coding in place to be able to reference to RDs or get kind of more culinary nutrition education, that could also help solve that solution too, because it is pretty difficult. Nice.
Yeah, I wanted to ask, because I'm curious, like how often are other people like in the household like involved in these conversations, like parents or anyone who's like living with them?
You want me? Yeah. And when in terms of conversations, just like nutrition conversations or food conversations, well, I would hope they would happen daily because everyone eats food every single day. But whether or not they're getting down to kind of like what's good for me, I don't know if I could really answer that question.
Yeah, I would say a lot of times we would want to include the family in the decision too, because a lot of times like a lot of these changes happen around meal times, of course, like we were saying. And again, it's kind of again, food is more than just like nutrients for our body. It's a cultural experience. It's there's relationships built around it as well. And again, when you can start to incorporate those aspects and think of it more than just like nutrients for the body, you can kind of see how it kind of supports people in more than one way. And of course, having their support system, their family in it as well, can definitely be something that should happen more.
And those are conversations that you could initiate too if you have someone who needs to kind of change how they eat. Like, don't try to change everything at once, and invite the family and be like, oh, hey, like we're gonna, how could we eat one more vegetable this week? Is there a recipe that you and your family enjoy that you could envision yourself cooking together, or just kind of asking those different questions so you could definitely engage more of the community support systems. Cool. Other questions? If you have any questions about like specific diets, anything you want to dive down in that area, we can answer any fun nutrition questions. So, nice. Cool.
Yeah, going off that,
Oh, yeah.
Going off of that point, are there any certain diets that right now you've noticed a lot of people are leaning towards that are actually like evidence-based?
I'm a few years out, so I don't know.
Well, I think I kind of mentioned that because I wanted to open up the conversations about diets and labeling and food labeling and how we're actually, it's a tricky realm because nutrition science, we're never going to have like a perfect double-blind gold standard study to say this diet's going to be the end-all be-all. Obviously, the Mediterranean's very big, and we do have more evidence supporting the inclusion of like heart-healthy fats and olive oil and all that stuff in fish. But at the end of the day, I think for me at least, I don't know about John, in my practice and the work that I do, a lot of the times it's shifting people away from the word dieting and away from labeling and kind of those constraints around what they eat and talking more about dietary patterns and just, you know, having a relationship with food and really thinking about where their food comes from and talking more about, you know, what you're eating daily in a sense that just makes you feel good and makes you happy, because I think most of the time when people start dieting or going on diets, it's restrictive, they end up falling off the wagon, but we do know that yes, eating more fruits and vegetables is probably a good thing for your health, but yeah, I don't know, what else do you want to add?
Yeah, I also don't really keep up with all the dietary kind of things because they keep changing with the seasons as well. But like Sky was saying, some of the basics that, again, always are going to be beneficial, including fruits and vegetables, definitely as well. And then, yeah, trying to talk about more about dietary patterns rather than just specific diets, because diets is a very kind of restricting kind of term, and someone feels like I can only eat this or stay on this line, versus like talking about, well, no, actually it can also be more empowering when you talk about kind of what they can do and more patterns to that as well. Yeah, again, I'm a few years out of practice since I started medical school, so I haven't been keeping up as much with the dietary trends though.
Yeah, I mean, I'm glad you asked that question too, because it kind of brings up, like, if you have a patient come to you and they're like, well, my neighbor just went on the ketogenic diet and I think that's the best thing for me. On your end, I would kind of, and you can, you know, correct me on this, like, would imagine that maybe just having like a good source of understanding what those diets entail, just for your knowledge, to be like, oh, I understand that that's like high fat, that you're removing carbs, and then kind of walking them through, well, what do you think the benefits of this are going to be? Yeah. Well, she said she lost a lot of weight. Oh, okay, so you're actually looking for weight loss. You're not necessarily looking to like completely uproot your diet. So maybe, you know, what actually intrigues you about this? Well, I like that, you know, I get to eat bacon in the morning. Like, I don't know, there's ways you can work around that conversation to where you don't have to be like, oh yeah, let's do the ketogenic diet, but let's talk more about the dietary patterns, the behavior change, what you actually want from it. Especially because some of those diets, like the keto diet, there's a lot of evidence now that it's really not good for long-term health necessarily, just because it can deplete you in certain vitamins and minerals and nutrients. Like, I don't know, a lot of the times with diets, it's all about the weight loss anyways, but yeah.
This kind of plays off the previous question you kind of talked about in your answer, but I had a question regarding people who have like some of these like niche fad diets. Like, I'm just gonna bring in like the carnivore diet, where they're like fruits and vegetables are a sin, I cannot have them, and like no fiber, just essentially butter, fat, and meats. And so my question is there, like, how do you talk to someone when their like basic understanding is so different from you when it comes to like nutrition and stuff like that?
Yeah. Yeah.
Oh, that's great. Yeah, keep going.
Yeah. Oh, yeah. So a lot of the times when someone comes to me with like that specific, like, well, I read this online and blah blah blah, I kind of start the conversation of like, well, where are you getting this information from, and who is actually providing it, incredible. And then again, I'll kind of bring it back to like, well, what are you hoping to gain from this? Like, what outcome are you looking for, and how do you think this is going to bring you to that outcome? And then on my end too, it's just trying to maybe dig a little bit deeper and provide them some resources for education. I think it depends on where they're at too, because if someone's like has already been doing the carnivore diet and it's working for them and they really like it, then as a physician, I feel like, I don't know, you could look at labs and other things to help maybe show them the negatives, or I don't know how to necessarily work around it in that nuance. But yeah, I mean, just asking questions of like, where did you get this information? how do you think this is going to benefit you, and then trying to like work around it a little bit. It's a lot of mind games sometimes, I feel like, with people. With the fad diets too, I think there are hopefully, well, I think there is some decent research articles now that you could probably reference and bring up with them of like, oh, well, long term, the carnivore diet's actually kind of shown to like alter your microbiome. You're not getting as much nutrient bioavailability, and fiber actually helps support a healthy gut microbiome. So you can kind of educate there as well. But I think understanding the why behind their making that choice will hopefully help you kind of reevaluate.
Yeah, no, I completely agree with you, Sky. Like, again, a lot of times someone's making these decisions because there's something, a motivation behind why they want to make this change or something, and just understanding that and kind of delving a little bit deeper into why they want to make these changes can definitely gauge your understanding of what they want, what you can provide for them as well.
Yeah.
Hi, do you have any information on whether intermittent fasting is good for you, or what would you say about that?
Do you want to open the can of worms?
Sure. Yeah. So fasting. Yeah, there's been a lot of different research, a lot of studies now about fasting. A lot of times, you know, when you start looking at fasting from a more kind of population standpoint, certain cultures have been fasting for like, you know, part of their culture as well, and that's kind of a staple in certain cultures. In the Western world, not as much because of our food abundance. And then there's things like timed intermittent fasting. There's kind of different types of fasting as well. There's been some research to show that there's different types of fastings could be beneficial, but again, you have to be very careful with that as well. You want to add more, Sky?
Yeah, I want to say Harvard has done some research articles coming out about it. My personal take on intermittent fasting is that if you are a normal human being and you go to bed for 8 hours or whatever hours and you wake up, like, you're kind of already doing a type of fast. So I think it's just a fancy term. I think when you get into like 12-hour fast or more than that, that's where you can look at some of like the applications of intermittent fasting. But again, like, I don't know, I always like to be careful with that because you can promote really unhealthy relationships with like food and going back to your why. Well, why are you intermitting in the fasting in the first place? What are you looking to get out of it? But I would check Harvard because I know that they've done a few studies recently. Another one that popped in my head was Stanford because I know that they've been doing that as well, but I can't remember the scientist who was doing that too. Yeah, it's a good question. That definitely is one of the fad things. One of the things, coming back to yours though, is in like the nutrition world, I think in the past, especially with government regulations, we've always focused on this kind of one size fits all thing and a population health approach, which we're shifting that now, and that's more of the preventative medicine narrative. And that's why conversations like this are super important, because we're trying to figure out, okay, we know that one size does not fit all, and we do have to individualize health, and we do have to look at the whole person and their lifestyle and their finances and their community, and how are we addressing that, and what tools do we have at our disposal to actually help them, because there is a lot of information out there. So cool.
Kind of going off of that, I just wanted to know how you would prepare to have these types of conversations about food with someone who might not be from the same cultural background as you. Like, what kind of research do you do to prepare for that conversation? Yeah, if you have any tips on that.
Yeah, that's a great question.
That's a great question.
Do you want to take it?
Yeah, I was going to say, again, that's another thing lacking in terms of a lot of our education is like cultural competencies, like you bring it up all the time. And again, if you look at the guidelines too, and looking at how different cultures don't even follow similar guidelines, because again, that's not part of their culture, and then kind of like shunning or shaming them for not following this kind of same narrative, it's absolutely something you don't want to do. So educating yourself on their cultural background is definitely one of the best things you can do. And a lot of that, unfortunately, comes on to you to do it yourself, right? A lot of times, even when I was going to school to become a dietitian, there was one class we took on like cultural diets, and just like one class once a week, and you know, it wasn't much. And again, part of that is just trying to say that to build a little bit more repertoire in terms of what you can do and provide for the patient. And now there is a little bit more information, and now like Sky said, one of the resources I used was eatright.org, which is like the dietitian's website. You'll go on there and they'll have some other kind of supporting evidence, but again, it's still not built out as much to help out, you know, your entire population that you're ever going to see. But I think it's a starting place and something that we kind of have to keep working on ourselves to educate.
Yeah, a good segue too is just is food. Because talk about food, talk about cooking, talk about buying a cookbook from a culture that you don't necessarily, that you aren't, is a good way to learn more about what they eat. Like I brought in some reference books that I really like, but this is a book called The Science of Spice. And it takes you through all the regions of the world and just talks about the different flavors. I think for me, I have like a leg up because I have a culinary background, and when you're trained as a chef, you get trained in all of the different cuisines, so you kind of get a good insight into that. But for y'all, I mean, it definitely, I don't know, I would say like picking up a recipe online from another culture and just cooking it at home, just so you're kind of familiarizing yourself with it. Because it is true, and we see that a lot in, unfortunately, how RDs are trained sometimes. We see a lot of almost, I don't know, like colonization in a sense of like, well, white rice is better than brown rice. You know, we've kind of debunked that, and you can't tell me, you know, it's a good conversation to have, yeah. Yes.
Lots of questions, love it.
Right.
So I have a question regarding if someone, for example, had like an eating disorder, or like a suspected eating disorder, how do you talk about diet with them?
Yeah, that's a great question. And again, eating disorders is definitely something very challenging that you're going to come across as well. As a dietitian, I worked with several patients with eating disorders as well. And again, every one of them was different. And that's something that is hard to kind of teach. But again, like you said, right when you said like talk to them about diet, that's the first thing we don't want to kind of think about is diet with them, because again, they also are thinking about that in this different terms, and that word can, you know, bring up different emotions to one another. So again, just talking about kind of, again, there's some underlying etiology behind kind of why they're having this eating disorder, and bringing that out and talking to them about that. It's going to take, you know, from my experience, multiple sessions for them to get comfortable talking to you about it. And again, referring to a dietitian there's specialist eating disorder dietitians as well that kind of really know this realm a lot better, and they can really help out. And again, that's like another thing is like, so, you know, as a physician, you're going to see people with type 2 diabetes, but again, if something's a little bit more out of your control, you can also refer out to an endocrinologist, right? There's a specialist in that realm. If someone comes with an eating disorder and you really don't know how to handle it, that's something super nutrition, food specific, that is something that you can always refer out to. There's dietitians with specialties in eating disorders that can help.
Yeah, and those are tough conversations too, especially because usually people who are in that state don't necessarily want to be told they have an eating disorder.
Yeah.
But it's it's a conversation that you can kind of, that culture question too is like, oh, well, what do you normally eat? Like, what does a dinner look like for you? You can kind of like use more broad questions to like help float around it, and then maybe refer out to an RD or someone else who could help support you and work with them, because most of the time they're usually probably going to need to see a therapist as well, and work with a care team to kind of get through that.
Yeah.
So something I've noticed recently in the last couple years more so is that with social media, it's very common for there to be prominent figures on social media who may actually be a physician, but kind of their corner of the internet is a lot of inflammatory statements that relate to nutrition specifically. And just because they have such a large platform and are confident in saying something very firmly, a lot of viewers can take that as truth, even if it's not rooted in any type of evidence-based science. So as either a health coach or as a health provider, when a patient approaches you and says, oh, well, I heard this information, they said it very definitively from somebody who they are viewing as reputable, you know, they are a doctor just like the person they may be speaking to in the second conversation. How do you approach that conversation? And then secondly, are there any specific like journals that you tend to follow to try to stay up to date on the actual science, so that when you engage in those conversations, you can be prepared to show evidence to try to educate patients?
Yeah.
Yeah, great question. And again, you're going to see that a lot definitely now, and that's kind of one when I put up that whole like there's a lot of rampant misinformation of nutrition as well. So one of the things is ideally you have a good rapport with the patient when they come in and talk to you about these things that they found, right? And so if you kind of have a good rapport with them, you can also talk to them about kind of what is their understanding of it, you know, again, the going back to the whole with what Sky was talking about, like the whole why about what intrigues them about this and why are they coming to you about this. And first of all, also for them to ask you about it is great because instead of just trying it right off the bat, that's another great thing. So having a good rapport with the patient and knowing that, you know, maybe that is someone that is probably reputable as well. But, you know, again, when they come to you and talk to you about it, hopefully you have a better relationship and you can talk to them about why this could be beneficial or harmful or what aspects of it are truth. Because there probably is some truth to a lot of things that they're saying. But again, like you said, there's kind of inflammatory statements where they're kind of exaggerating kind of the benefits and not talking about the limitations as well. So that's kind of the first part. The second part in terms of like journals or things like that, of course, access to up to date might have some of these things as well. You can that's one of the quick things you'll see. You can look things up there. A couple journals that, again, the hard part about this is these fads come so quickly, so to get time to get these kind of literature researched and published takes a little bit longer, so it's always a little bit delayed. But again, some journals, I'm trying to think, I know the Academy of Nutrition and Dietetics has their own journal. That's again the one that my credentials were from the dietitians, and they're the national providers for nutrition. What other journals? I mean, again, a lot of the big ones as well will also have things, but again, it's just going to be a little bit further behind, and so it's kind of up to you to try to keep up to date with it as well.
Yeah, I was going to say the same journals. Usually I have that one that I subscribe to that I really like, but like you said, it's kind of hard because these trends are moving so quickly. So like a good example, and it's funny you say that because I see doctors pop up on my feed all the time now, and I'm just like, all right, okay. But yeah, I think like John said, it's like kind of drawing back to the why and digging into the information. Like for some reason, my mind kind of came up, oh, well, this doctor said I should drink celery morning for X, Y, and Z, and you can kind of go to that conversation. It's like, oh, well, what do we know about celery juice? Like, you know, we know it's got some water in there. Like, you can kind of talk about the nutrients and like, and then, oh, well, what do we know about how the body detoxes itself? Well, we know that the kidneys and liver and stuff. Oh, okay. So do you really think for you, like drinking celery juice in the morning is gonna, or you can ask like, well, what would drinking celery juice in the morning like actually help you with? Yeah, just like asking those questions and knowing the why, and then walking through like, well, what do we actually know about this to be true? Which a lot of the time it's like, well, we know the nutrient content, we know what the body can do. Yeah, I don't know. I'm trying to think of other ways to work around it, but it is tough because it's someone that they're viewing in the light, and you don't want to just discredit or bash the person, but I think just having the conversation around it will help kind of maybe defuse it in a way that's easier to move through. Yeah, nice, cool. Is that all the questions? I will say one thing I forgot to mention that as a tool that RDs use, but doctors could probably adopt too, is nutrition-focused physical exams. You're welcome to take a picture of this book. It's just a fun little guidebook that goes through like signs and symptoms of like vitamin and mineral deficiencies. So it's really cool, and it has like little photos and stuff in it. But nice to like correlate when you're already doing the physical exam with people, and it helps open up conversations too around different things. So it's kind of another segue to talk about food and nutrition.
We've got our last question ready.
Thank you. I have two quick questions. So my first one is pretty basic. I just want to understand whether there's a difference between a dietitian and a nutritionist. And just because I've never really looked into that. And next, I want to know like how, or if there's psychology training within the realm of nutrition dietitian school, because I can imagine that since a lot of this really involves behavioral change, that tends to fall under the scope of psychologists. And so I wonder if like, or if not, if there's like a collaboration usually between like therapists and nutritionists in helping patients.
Yeah, great questions. So yeah, the first thing is To be a registered dietitian, which is my background, you do go to school, you complete a dietetics education, and then you do a dietetics internship, and then you pass the board exam to be a registered dietitian. And so that, compared to like a nutritionist, is someone maybe just knows about nutrition, but doesn't have that credential that's certified by the Academy of Nutrition and Dietetics. And then secondly, yes, thinking back at my education for dietetics, there was some aspects of kind of, like you said, a lot of this is behavior change, and trying to talk about that using skills that Sky talked about motivational interviewing, talking about Maslow's hierarchy of needs as well, and trying to understand like what is preventing someone, or what can we do to help them out. That's a lot of it. And I think one beneficial thing that I got out a lot from being a dietitian was just talking and having that conversation, understanding a little bit more about, opening up and talking to the patient about what is, preventing them, what it can do to support them. And like Sky said, we're really trying to be an ally. We are the expert, but at the same time, we have to shift that role to be more of a support to them. And there was also a lot of support with other professionals, healthcare professionals in that realm as well. And I did. A lot of times I would also refer out. They were also being seen by psychiatrists as well for a lot of these conditions. And I was another case, I was just another provider as well, helping them, because they were being seen by a physician, they were being seen by a psychiatrist, they were being seen by a social worker. I was there supporting them as the dietitian as well. So it's not just one single thing that's affected too, like you're saying, it's more of a collaborative thing, whole body system.
Yeah, and I will kind of play devil's advocate on the dietitian and RD, because I'm technically a nutritionist, so I did go through all of the undergrad didactic training to become an RD. I just chose not to take the RD test because I didn't want to work in a hospital. And I think what differentiates an RD from someone like with my background, who I still went on to get my master's in nutrition, I'm probably going to do my PhD, so I am a qualified nutrition professional. I just don't have an RD, which kind of differentiates, like, I will not practice medical nutrition therapy within a hospital, but I could still be a valuable resource for nutrition education, for wellness curriculum, kind of for like a different dimension of nutrition training. So it kind of gets a little like gray zoney sometimes, unfortunately, because someone with like a PhD in nutrition who's like super knowledgeable still can't be an RD and prescribe someone a diet and work in a hospital. But then we have on the lower end someone who's like an online health coach who calls himself a nutritionist and is like telling people. So I think there's other credentials that are emerging now. Certified nutrition specialist, which is basically kind of an equivalent to an RD, is slowly emerging. They're just not recognized in hospitals, but like my background, it's like I did do 1,000 hours of nutrition education and coaching and counseling. So there's different layers to it. It's hard, especially in today's world. The RD is always going to be the gold standard because they're very specifically qualified to work with hospital patients to understand tube feeding formulas, like all of this amazing stuff. So we'll see that space kind of evolving. But yeah.
I know we're at time, and thank you everybody for coming. We appreciate your attendance at these. John is not only today's excellent co-presenter, but he's the ambassador between the Office of Medical Education and our office. So if there are topics you'd like to see discussed at a future Lunch and Learn, or if you'd like a different menu, you can complain to John and he will pass that on in a very diplomatic way. Just two quick things. First of all, this lunch did not contain any lectins. That's a joke. I think we're all rational enough to know that a tomato seed can't kill you. The second thing is there's a website called Oldways, and they are a heritage and traditional diet resource. So if you have somebody that is either new to this country or has a very specific and slightly obscure diet, that's a really great resource. Oldways.com, and they have a bunch of different resources, but their heritage diet page is probably the one that would answer that question. So quickly, thank you to John Lew and Sky Hanka for presenting today on nutrition in scope of practice. Thank you all for coming, and we will see you next month for next Lunch and Learn. I think Sky and John probably have a couple minutes if there are real specific questions.
Oh yeah, I was also
Great week.
gonna say we did like a little post Lunch and Learn survey. So if you wanted and had time to take it, you can put like other topics you want to hear about. The survey also just includes some questions about like nutrition education and what tools you would like, what we at the Office of Wellness Education can provide you with in terms of like tools, templates. It also kind of asks about if you're interested in more hands-on nutrition and culinary education and in what format we could provide that for. We're really just another resource for you. So we really want to just be able to provide you with whatever you need and answer your questions. So, yeah.
Thank you all.
Thank you.